In December 2019, the first case of SARS-CoV-2, better known as COVID-19, was identified by Chinese healthcare workers in Wuhan, China. Little did these Chinese healthcare workers know that this new virus would go on to spread far beyond their city. The ongoing COVID-19 pandemic has changed the world in ways most people alive today have never experienced. Restaurants have closed their doors, professional sports leagues have canceled or postponed the rest of their seasons, students' dream graduations have been squashed. The list goes on. Some have made claims that COVID-19 is a precursor to the end of the world. Others claim that it was created by governments as a means of controlling the people. Despite the conspiracy theories and the fear amongst humanity during these trying times, epidemics and pandemics are nothing new to humans. There have been over 20 known pandemics, ranging from many centuries ago to just recently. But very few shook the world quite like the Spanish flu pandemic of 1918. Influenza, better known as the flu, is a highly contagious virus that attacks the respiratory system. It can be spread when infected people cough, sneeze, or talk. Respiratory droplets are transmitted in the air and can be spread to people nearby. It can also be spread if someone touches a surface with influenza on it and then touches their eyes, nose, or mouth. Flu outbreaks occur annually, and in developed countries like Canada, usually isn't something people worry much about. On average, in Canada, the flu will usually kill 500 to 1,500 cases per year. Worldwide, the death toll usually ranges from 290,000 to 650,000 deaths. Spanish flu was a particularly deadly outbreak of the influenza virus, caused by a new strain of the influenza virus known as H1N1. At the time, there was no immunity to this strain, causing many to get sick. Unlike COVID-19, which is known to have originated in Wuhan, China, no one knows exactly where the Spanish flu originated from. It was first observed in Europe, Asia, and the Americas before spreading all over the globe. The first recorded cases were from a military camp in Kansas. The name Spanish flu is misleading, as the Spanish flu did not originate in Spain. During World War I, Allied nations and the Central Powers heavily censored their news publications. Spain was a neutral nation during the war and had free media that covered the outbreak from its beginning. As Spanish news sources were the only ones publishing reports on the flu, many countries believed it originated there, hence the name Spanish flu. When the 1918 flu hit, doctors and scientists were unsure what caused it or how to treat it. Unlike today, there were no effective vaccines or antivirals, that is, drugs that treat the flu. In addition, medicine was not nearly as developed as it is today, and much of the medical force had been overseas helping in the last war efforts. Many were also living in close quarters due to the war. This caused the Spanish flu to spread very rapidly. The first wave took place in the spring and summer of 1918, but there was a second wave in the fall of that year, caused by an extremely contagious and even more deadly mutation that killed 90% of all Spanish flu victims. Some died within hours of becoming ill. Inadequate quarantine measures, powerlessness against the illness, and a lack of coordinated efforts from health authorities led to unsurmountable chaos. The Spanish flu infected an estimated 500 million people worldwide, about one-third of the planet's population, and killed an estimated 20 million to 50 million victims. It remains the worst flu pandemic in recorded history. One unusual aspect of the 1918 flu was that most of its victims were adults between the ages of 20 and 40. The standard flu primarily affects the very young and the very old. With so many victims being working-age adults and the impact of World War I already costing countries many of their young and able men, the economy was brought down. Businesses were forced to shut down due to sick and dying employees, hampering efforts to provide the public with answers about the flu. By the summer of 1919, the second wave finally came to an end, as those that were infected either died or developed immunity. However, a third wave stretched through the winter, and the pandemic wasn't officially considered eradicated until the end of 2020. Spanish flu and COVID-19 have similarities, but also differences. No one is immune to COVID-19, but it primarily affects and kills the elderly and those with other health issues. The young and healthy can be infected, but are usually not severely affected and rarely die from COVID-19. Spanish flu, on the other hand, was largely killing young and healthy people. This is the key difference between the two viruses. COVID-19 is closely related to two other viruses that have caused epidemics: SARS, or Severe Acute Respiratory Syndrome, and MERS, or Middle East Respiratory Syndrome. Spanish flu, on the other hand, is, as previously mentioned, a strain of influenza, which is not a coronavirus. In terms of how we are dealing with the spread of the virus, many of the same measures are being taken, with the wearing of masks in public, the closure of schools, churches, and workplaces, and the cancellation of public gatherings. In the case of the Spanish flu, however, it occurred before federal health departments existed. Each jurisdiction had to deal with the problem on their own. Nowadays, there are federal health departments that are leading the charge against COVID-19. Another major difference is news coverage. As previously stated, Spanish flu was so named because of news censorships. While it is believed that certain countries, such as China, are purposely hiding the true number of COVID-19 cases in the region, media in many countries is not being censored at all, almost to a fault. The media of 1918 harmed people during the pandemic by not telling them anything. The media of 2020 is harming people with excessive fear-mongering and a constant stream of doomsday reports, leading to conspiracy theories in every corner of the internet. These news approaches are very different. In the past, there was not enough media coverage. Today, there is too much. While these approaches are at opposite ends of the spectrum, they are both just as harmful to the function of society. Not hearing enough leaves society unsure of what is to come and creates havoc in that people don't know what to do. Hearing too much leaves society in constant fear and creates havoc in that people are constantly speculating the unknowns to cancel out the fear, effectively doing quite the opposite. So, what lessons can we learn from the Spanish flu epidemic of 1918 as we try to navigate COVID-19? One lesson that was learned from the Spanish flu was the importance of federal and global health departments. It broke out before the World Health Organization and federal health departments were founded, leaving each province and state to handle the flu on their own terms. Canada's federal health department was founded shortly after the Spanish flu ended. Another lesson is that, in moderation, the press is important and must not be excessively censored. A lack of information led to a lack of preparedness. While I can't say I am a fan of the overload of media, I also wouldn't be in favor of a complete censorship. The Spanish flu became so dangerous in part because most jurisdictions were unprepared, as they did not receive much warning in advance. Finally, the most important takeaway is that if those that came before us survived the Spanish flu, we can survive COVID-19. Just because it seems insurmountable now doesn't mean that this is the end of humanity. These people survived the Spanish flu when there was almost no possible treatment, right after a deadly war, at the time the biggest in recorded history. We can survive COVID-19. Our lives may never be like they were before, but we will survive. This is not the end of the world.